My general day usually has a mix of pediatric sports medicine patients and general pediatric patients. When I see my general pediatric patients, I always have an emphasis on preventative care, and I will always try to incorporate some of my sports medicine training into those encounters. When they come to me for an injury, I'm not only trying to come up with a diagnosis and figure out what happened and how we can manage that diagnosis, but going a little bit further and thinking about why did they sustain this injury and what can we do in the future to prevent them from getting further injuries. If I'm seeing someone who's not necessarily an athlete, I like to say everyone's an athlete, they just might not know it. I think there's no better way to prevent serious illness down the line than being physically active and also doing something you love. Playing sports, being physically active is not only good for physical health, but mental health. And so I pride myself really on trying to encourage people to become physically active and then also getting them back to being able to be physically active. So if there's an injury or illness or concussion that is keeping someone from their activity, I pride myself on really trying to get them back to that previous level of activity so that we can still work towards their overall mental physical health.